Hi, everyone. My name's Casey Gordon. I've been a nurse for over 7 years and a tech and nursing assistant for even longer. I've spent most of my career in the emergency room, where most of my aging service has come from. I'm now in the PACU. Um, I interviewed Marlene Sheehy, who's an RN BSN. She currently works as the VP of Sales and Marketing for Clinware. She focuses on improving transition of care for aging adults between hospitals and skilled nursing facilities. This is an artificial intelligence software company. Marlene has had 29 years of nursing experience, both at the bedside and as a clinical or case manager. I chose to work with Marlene not only because of her passion for caring for the aging population, but also because this is a job that I am unfamiliar with and a sector of the healthcare world that I am definitely unfamiliar with. She moved from bedside nursing to healthcare technology, but she still advocates for older adults, just in a completely different way. She's extremely motivated to make changes in areas in which she was unable to do as a bedside nurse. And I was very excited to be able to meet with her and listen to the changes she's making. So before this interview, I honestly thought of AI or artificial intelligence mostly as something that could only help providers document and write notes after an interaction or to answer questions for a patient. I didn't realize, however, that it could solve one of the biggest problems that I saw while working in the emergency room. I had a patient one day come in, like any other day, from a nursing home. And they usually come in with a big binder full of medical information, none of which is pertinent to the reason that they're coming in. It was usually full of med passes and handoffs between nurses, but it was never a front sheet with actual information with allergies or contacts or how to get the patient to take their medications. Do they like it in applesauce or ice cream? Like actual helpful information. So I had this patient who clearly had some cognitive decline, whether that be dementia or otherwise. She had fallen, and we were worried about either a cervical spine injury or a head trauma of some sort. And we were treating her as though she had one of those injuries, so we wanted to scan head and neck. Nowhere in the first at least 15 pages of the chart were any allergies listed. Multiple pages had listed no known allergies, no documented allergies. And I had tried calling the daughter that was listed as the emergency contact, and it went to voicemail. So, like we normally would have done, I followed what the book said and what the report said from the nurse that I got report from and the EMT. I threw in an IV and I whisked the patient off to the CT scanner. And as the patient's going in for a CT with contrast, the daughter calls me back and says, "Oh no, my mom has an allergy to IV contrast." So I immediately dropped the phone and run over to the CT scanner, which thankfully wasn't far, and stopped the CT before they put in contrast, and she would not have an anaphylactic reaction. Software like Clinware can save this kind of incident from happening. Clinware's services bridge that gap between SNF or skilled nursing facilities and emergency rooms or acute care, post-acute care facilities or hospitals. What they do is they use Epic point and click care models It's like using a standardized electronic health record in order to make sure that these instances aren't missed. That made me immediately understand why ClinWare exists. You have the patient come to the hospital, AI reviews the chart, the information is immediately transferred, the skilled nursing facility knows patient needs, the hospital knows what the patient needs, there's better reimbursement purposes through Medicare, Medicaid, and there's safer transition for nursing to care for that patient. That's much easier to follow. It's much simpler. There's less patient risk. There is better team communication, better care transitions, interoperability, and that AI software is built to bridge that gap. This is extremely important so that way there are no near misses, there are no casualties, and there are no centennial events. During this class, HP 626, we have talked a lot about social, political, economic, and technological perspectives in gerontology. Social issues such as transportation to and from appointments, social isolation can lead to depression-like symptoms, especially in older adults. Isolation such as not having family to be able to be some of the drivers to and from appointments, no longer having friends because they have passed or are now in nursing homes, things like that. And health literacy decline, such as cognitive, vision, or hearing impairment. These are all things that come into play. Technology can improve communication amongst aging adults, but it cannot solve loneliness or transportation issues. Political, Medicare, Medicaid, CMS regulations. If facilities are not reimbursed appropriately, it affects staffing and ultimately affects the patient's care. As I had mentioned earlier, situations in which software like ClinWare are able to appropriately streamline patient care and address situations, reimbursement would be faster, it would be more appropriately applied, and therefore Medicare, Medicaid, CMS would all have better reimbursement. In terms of economics, accurate documentation isn't just about billing. It determines whether facilities have the resources to continue caring for residents. So things like staffing or facility closures due to the fact that there isn't enough staffing or enough revenue coming in due to denied claims or funding. The biggest thing that I learned throughout this whole process was that improving healthcare isn't always about creating another medication or another treatment. Isn't about always providing the best hands-on care, but sometimes it's about making sure that the right information gets to the right people at the right time. One reason I specifically petitioned to take this gerontology class is because I recognize the impact our aging population will continue to have on the healthcare system. The population is only going to get larger, and there's only going to be fewer of us to care for them. Throughout my nursing career, I have seen communication gaps during patient care transfers, and I never realized how much those gaps affect patient safety, reimbursement, and the quality of care until this interview. As a future nurse practitioner, I want my documentation to be organized, accurate, and useful, not only for me, but for every provider who cares for my patients after me. When people hear artificial intelligence, they often think about replacing healthcare providers, but after this interview, I see it differently. I see AI as another member of the healthcare team. It can't replace clinical judgment, compassion, or human interaction, but it can remove barriers that prevent providers from delivering the safest care possible. If we can combine good technology with good healthcare professionals, I believe we can significantly improve care for our aging population. AI can be more than just documentation. It can be solutions to the problems we run into every day. It's not necessarily here to replace our jobs, but to improve and maybe create new ones. Thank you so much for listening to me today. I appreciate you guys, and I can't wait to see where the future brings all of you.